Hi, thank you for joining me. My name is Catherine. I am a respiratory therapist, and I will be going over understanding obstructive sleep apnea with you today. We will cover what OSA is, signs and symptoms, common coexisting health issues, diagnosis, and treatment. You may have heard the term obstructive sleep apnea, or OSA, and not really understood what it is or what it involves. Well, it is when a blockage in your airway keeps air from moving through your windpipe while you're sleeping. This can cause your blood oxygen levels to drop so much that your brain triggers a reflex to wake you up so that you can start breathing again. And while this keeps you alive, it can also cause different health issues and create a wide range of symptoms. Some of the signs and symptoms associated with OSA are feeling overly tired even when you've gotten enough sleep throughout the night, mood changes, headaches, memory loss, and trouble concentrating, snoring, or waking up choking or feeling like you're out of breath. While OSA affects a wide range of people, there are certain populations that are more susceptible to it. Middle-aged men between the ages of 30 and 49 are 4 times more likely to have OSA than women in the same age bracket. However, that drops to 2 times as likely between the ages of 50 and 70. People who are overweight or who are obese, and also those who are of African American, Hispanic, Latino, or Native American descent. If you've been experiencing any of the symptoms that I went over, such as waking up tired all the time, waking up choking during sleep or feeling out of breath, snoring, brain fog, bad memory, or happen to be in the patient population that I just went over, you could have undiagnosed OSA. With us leading such busy lifestyles and always having so many things on our plate, it's very easy to dismiss what our body's trying to tell us. So if you do have any of these signs or symptoms, please reach out to your healthcare provider to discuss further options. Due to missed symptoms or lack of awareness, an estimated 80% of people with sleep apnea remain undiagnosed. Having undiagnosed sleep apnea can either exacerbate already existing health conditions or even create health conditions that you wouldn't have if you weren't suffering from sleep apnea, such as COPD and emphysema, cardiovascular disease like high blood pressure or even heart attack, type 2 diabetes, GERD and peptic ulcers, and also anxiety, insomnia, and depression. OSA can worsen these conditions, so the sooner that you speak with your healthcare provider to get treatment, the better healthcare outcomes you will have. Once you've spoken to your healthcare provider, the next step will be officially diagnosed. In order to do that, a test called polysomnography will need to happen. This is better known as a sleep study. Polysomnography or sleep studies are usually done overnight in an outpatient clinic. Things like heart rate, respiratory rate, eye movements, leg movements, and oxygen levels in your blood, along with your brain waves, are monitored to see if you're having any issues with OSA. In order to diagnose that, there are different levels that you can be registered as. There's none or minimal, which is less than 5 events per hour, mild, which is 5 to 14.9 events per hour, moderate, which is 15 to 29.9 events per hour, and severe, which is 30 or more events per hour. Once a diagnosis has been made, and depending on the severity of your diagnosis, you and your healthcare provider can come up with a treatment plan to help alleviate the symptoms of your OSA, whether that's lifestyle changes such as more exercise or losing weight, oral devices that can help with alignment of your tongue, or a CPAP device that helps push air into your airways to keep them open. You and your healthcare provider can decide what is best for you and your situation. Sticking to your treatment plan is crucial to help improve symptoms of OSA. Oral appliances show improvement in 97% of patients. CPAP therapy shows improvement of symptoms in up to 75% of patients, and lifestyle changes such as losing even 5 to 10% of your body weight can also help improve the symptoms of your OSA. I hope this video has helped to clarify what signs and symptoms of OSA are, who they can affect, how to get diagnosed, and what types of treatment options you may have in order to improve your lifestyle. Thank you and have a great day.